So now within this bony orientation, now all the anatomical structures are gradually replaced now. So this is the ICA, and here is the ophthalmic artery and the optic nerve. And this is the optic strut, which separates from the optic canal from the superior orbital fissure. The better orientation you can see here. So this is the lateral view. So here you can see this is the anterior clinoid process. So there will be various dural reflections over the anterior clinoid process. There will be various dural reflections over the anterior clinoid process. So this is the anterior clinoid process. This is the optic strut. And this is the various segments, the clinoidal segments. So here you can see the dural reflections, which is running above the anterior clinoid process and which is running below the anterior clinoid process. So the dural reflection, which is running below the anterior clinoid process, forms the proximal dural ring or the lower dural ring. This is also called as the carotid oculomotor membrane. Okay, so this is the proximal dural ring or the lower dural ring. The dural reflection from the upper border of the anterior clinoid process forms the distal dural ring or the upper dural ring. Okay, so the proximal dural ring and the distal dural ring. The proximal dural ring is also called as the carotid oculomotor membrane, which forms the roof for the cavernous sinus. So here is the cavernous sinus. So this carotid oculomotor membrane forms a roof for the cavernous sinus. And through the carotid ocular membrane, the third nerve exits the cavernous sinus. So I will show the pictures in the subsequent slides. So this is an anterior view of the same anatomical orientation. So this is the anterior clinoid process, and here it comes the ICA. So the dural reflection below the anterior clinoid process is the proximal dural ring or the lower dural ring. The dural reflection above the anterior clinoid process is called as the distal dural ring or the upper dural ring. And then is the ophthalmic artery. This is ophthalmic artery, and medially you have the superior hypophyseal artery, which supplies the pituitary stalk and the optic chiasma. So here you can see this is the carotid oculomotor membrane, and this is the cavernous sinus. This is the cavernous sinus, and you can see the third nerve exiting through the carotid oculomotor membrane, which forms the roof of the cavernous sinus. So again, the anterior view with the ICAs. So we can clearly see here, this is the anterior clinoid process. This is the dural reflection above and below the ACB, which is called as the distal dural ring on the proximal dural ring. And here what you have a space called as, based on the dural reflection, you have a space here which is called as the carotid cave, which is also one of the potential site for the formation of an aneurysm. It is called as the cave aneurysms. So first about the clinoid segment aneurysm. So the two anatomical variants in the clinoid segment aneurysm is the anterolateral variant and the medial variant. Okay, one is the medial variant and then is the anterolateral variant. So these two variants is shown in various views. So this is the anterior view, this is the lateral view, and this is a superior view. So you can see here with the superior view, the superior hypophyseal artery and how this medial variant is related, which is seen arising from the medial and inferior part of the ICA. The anterolateral variant is seen arising from the dorsal and the lateral part of the ICA. So this is how the relationship of the clinoid segment aneurysm with the various structures in the ICAs are related. So that is how the V1 segment is related. The V1 segment of the trigeminal nerve is related here. So the most of the time, the clinoid segment aneurysm presents with headache, mainly because of the stretching of the dura adjacent to the V1 nerve. So that is why the patients may present with headache, especially because of the involvement of the V1 in clinoid segment aneurysms. So here you can see this is the anterolateral variant. So you can see here this is the anterolateral projection. Okay, this is the anterolateral projection. So what you see here is the anteroposterior view. This is a VRT sequence, and you can see the ICA bifurcating into the medial A1ACA and the lateral M1 MCA, and this is the anterolateral variant. And here Similarly, this is an AP projection of the cerebral angiogram. So what you see here is the ICA, then going into the bifurcating into the medial A1AC and lateral M1 MCA. So here you have the medial variant of the aneurysm. So this is the medial variant. This is the VRT sequence. What you see here is the medial variant of the clinoid segment aneurysm. So then the ophthalmic segment aneurysms. So here there are three types. One is the ophthalmic artery aneurysm. Then you have the superior hypophyseal artery aneurysm, and then the dorsal variant aneurysm. Okay, dorsal variant aneurysm. So this is the anterior view. What you can see here is this is the ophthalmic artery. And here you have, if the aneurysm is just distal to the origin of the ophthalmic artery, this is called as ophthalmic artery aneurysm. If the aneurysm is seen some distance away from the origin of the ophthalmic artery, this is called as a dorsal variant aneurysm. If the aneurysm is seen closely associated with the superior hypophyseal artery projecting medially towards the pituitary stalk, it is the superior hypophyseal artery aneurysm. So these are the various variants of the ophthalmic segment aneurysm. So this is the projection. This is the cerebral angiogram showing the ophthalmic artery aneurysm. So this is the ophthalmic artery aneurysm. So here is the origin of the ophthalmic artery, and here is the ophthalmic artery aneurysm. So this is a superior hypophyseal artery aneurysm. So here what you see is a superior hypophyseal artery aneurysm. So which is seen medially towards the pituitary. So this aneurysm is seen projecting medially towards the pituitary. So that is superior hypophyseal artery aneurysm. Then this is the dorsal variant. This is the dorsal variant aneurysm of the ophthalmic artery. The dorsal variant aneurysm here. So this is the ophthalmic artery. So how you should differentiate is if it is just the aneurysm is just distal to the ophthalmic artery, this is an ophthalmic artery aneurysm. If the aneurysm is seen a bit some distance away from the ophthalmic artery, this is called as dorsal variant of the ophthalmic aneurysm.